Say thank you for those that have subscribed to our YouTube channel. We want to say thanks to those that have liked our videos. So again, I wanted to say thank you. And the reason why we're doing these Facebook Lives is because we want to, and not only do we do the Facebook Lives, we do online consultations, we do online in-services, we do on-site in-services, and we do the Facebook Lives, and we've created the Purposeful Foam Rolling. We've done that because we want to help educate and to teach people about muscle tightness, stiffness, and soreness, and the pain patterns that those tight muscles can create, because every muscle in the body gets tight, stiff, and sore. It just does because we've lived our lives. And as we live our lives, then muscles get tight, they get sore, they create hyper-irritated points, and we can get pain patterns. So let's talk about another muscle of the face, because we've been sort of focusing on the face. And this is another one of those muscles. It's an interesting muscle called the Buccinator. And it sounds like it should be on a pirate movie, or it should be one of Arnold Schwarzenegger's movies. But it is a muscle of the face. And just like every other muscle in the body, it can get angry, it can get trigger points or hyper-irritated points, and those can create pain. So let's talk about that. But again, if you like our videos, if you like what we're doing, please subscribe or like us, and we're going to continue doing this. All right, so where is this muscle, the Buccinator? Well, it's in the cheek. It's right here. If you look at Mr. Manny right here, there's a muscle that goes around our lips, just like this, and then coming off of that circular muscle of the lips is the muscle Buccinator right there, the one in blue. And for us to find it, it is literally coming right off this area of the mouth, this little corner of the mouth here. There's a muscle, that outer side of that muscle that makes the circle. So if you put your hand right there, you're really right at the very end of that muscle, and then just move your fingers up along the cheek, kind of moving toward the back of the ear, okay, or moving toward the ear. And that's where this muscle resides. And then you're going to kind of hit this bony spot right here. It's actually a muscle, but it feels like a bone. For most of us, it's kind of tight. And that's where this muscle ends, roughly right in there. So this is the location of the muscle. If you put your hand or your fingers right here, like this, you can blow out and then bring your lips out. And you'll feel this muscle move back and forth. So it's just basically pucking your lips, opening your mouth, and you'll feel that muscle move back and forth. Okay, it's one of the things that this muscle does. So what's interesting, this is one of the first muscles that the human being can actually control. So as a baby, this is one of the first muscles that we can control. It's actually a muscle that's in the sucking reflex that babies have. And if this muscle is impacted in any way, it can make speech very difficult for us. So it's just some of the things that this muscle does. Others, it helps us chew our food. It's involved with the tongue and helping us chew our food. If we pucker our lips up a bit, this is involved. Whistling, wind instruments, those type of things. And it just helps with all the wonderful facial expressions that we have as human beings. So again, a great muscle. So we talked about the location. What happens when this muscle gets tight? And again, every muscle in the body can get tight. And when we talk about the face, a lot of facial muscles can get tight. This is one of them. And if you see Mr. Manny here, this is where the pain can radiate. It's usually deep into the jaw, or the cheek, and deep into the jaw, sometimes even making the teeth, the upper part of your teeth can feel like there's an abscess in the tooth somewhere in your mouth, usually the upper part of it, and into the cheek. So it can cause local pain in the cheek, deep-seated pain in the cheek and the jaw. It can make swallowing difficult. Chewing can be painful. And whistling or playing a wind instrument can be very painful. So again, it's not a very big muscle. It usually gets one trigger point, but it can impact our quality of life when this thing gets angry and tight. So what do we do to help get it to loosen up? Well, pretty much all the muscles of the face that we've talked about, I talked about taking a nice, hot, moist heat pack and placing it right on the face and letting the whole face relax, because this is one of many muscles of the face and head. So if we get everything starting to relax here, it's going to help this muscle to relax also. So again, just putting a nice moist heat pack, hot moist heat pack on the face and letting it rest there for a while starts us to relax, starts the muscles to relax, and then we can get in here and we can just massage. So just massaging your cheek muscles. You can take your fingers and make rotation movements. You can strip your muscles, so coming from basically up by that ridge and coming toward your mouth, just like that. That's another good movement to do to help work that out. You can do what's called a pincher grip, which is to take the thumb, put it inside the mouth, and pinch it with the outside finger, the pointer finger on the outside of your cheek, and work that together. Especially if you've got a really tight, tender spot there, that's a good one to work on. So taking that finger, the thumb inside the mouth, take the pointer finger, and just sort of pinch and just massage it, running your fingers together just like that on that muscle, pretty much anywhere that's muscle there, work all the way around there, and that'll help that muscle relax. You can also take your thumb and sort of pull the muscle outward as you just run alongside the muscle on the inside of your cheek and pull it outward a little bit, not a large amount, but just a little bit, and that'll help stretch out that muscle. So those are some very easy things to do to get this muscle to relax. So again, if you're having pain chewing, if you're having some difficulty swallowing, especially if you're having difficulty swallowing, you probably want to check your doctor. But a lot of times they're like, look, we don't see a problem. It could be this muscle, and then you want to get in there and work on that. Okay, but any kind of pain in the jaw, that type of thing, try this and see if that works. And then if not, then have it looked at. But again, swallowing is one of those things you don't want to mess around with. If you're having difficulty swallowing, you want to have that checked out by your doctor first. Okay, I hope that's helpful. Again, we do online consultations, we do online in-services, on-site in-services, and we also have a whole host of videos on our Facebook, and we're going to continue to do our Facebook Lives. So again, if you'd like, put something in the comments, talk about a muscle that you're having difficulty with. We'd love to hear it. All right, take care and have a great day.